Hi, students. Let's just do a quick review here over the injury section. So, a couple of good points here to remember is your seventh character. So, it's really important in the injury section because we have the initial encounter, which is A for seventh character. We have the D, which is subsequent, and then S is sequela. Remember when coding multiple injuries, you always sequence the one that is the most severe. That one always comes first. You want to make sure you do the external cause of morbidity. So with these are going to be your, so if I pull up, they're going to be my external cause codes, which we will use a lot. It's really nice to use the encoder for these because it's pretty quick to find your answer then. I shouldn't say quick, but it is a lot easier, that way. Um, with your external cause codes, remember we have sequencing. External cause codes are never ever principal diagnosis. Make sure you code by the intent, place of occurrence for these. So once we move into the fractures, the biggest thing is to pinpoint where that fracture is. The other thing is if it doesn't state open, you do default to as the fracture being closed. So just kind of remember that. With that, I am going to go through the first problem because these can be a little bit tricky. You're not used to doing all this extra type of coding. So with that, um, I'm going to start running through problem number one, which you do have the answers for. So let's just look here. The patient was struck in the face by a softball during a game. They did not lose consciousness. They did have a severe compound fracture. Make sure you look to see what a compound fracture is. That does mean open. And it was of the sinus bones. They were debrided. An open reduction was carried out. Postoperative course was uneventful. They did do nasal packs, sutures, and a nasal splint were removed. However, on the 8th day, they became confused, combative, so they did a lumbar puncture, and the patient started getting or was positive for submeningitis. Improvement was rapid with antibiotics and steroids. Okay, so again, when we look at here the principal diagnosis, what brought them in? So the first thing we want to code for, it's going to be the fractures, okay? And if you look here, which one's going to be, again, most severe? It's going to be the skull fracture. That's going to be a lot more intense versus your nasal bones. So we have the base of the skull, okay? And if you look up here, um, it talks about we have the sinus frontal bones, okay? But then if you go down here, we have a compound nasal ethmoid and frontal sinus fractures. So let's go with that first. So again, once you look up fracture, one thing to remember, you want to go to traumatic. The only time you don't use traumatic if it's pathological, okay? So pathological means just the bones are getting weak and you don't want to go with that. So we're going to go traumatic and then I'm going to go comma, skull. And if I go base, okay, then it's going to take me to, I have other fracture base of the skull. So I want to go base and we are going to go down to here specified, which takes me to S0219 and then I'm going to click on that. This is initial counter open, so it's going to be XB. Okay, same thing with the next one, fracture of the nasal bones. And then we want to code the meningitis. Then we get into all of our external cause codes. Okay, and then next we're going to do the reposition, which they did the ethmoid bone first, then we went to the frontal bone. These are all open approach. And then we went to code that last procedure, the lumbar puncture. So just remember when you are coding to make sure you click on procedures, external cause, so that you're in the right area. Okay. So I did give you the answers to this one. You have the answers to a few other ones. I am just going to not do a couple, but I'm going to talk about the burn unit. A couple of things to remember with the burn unit. Okay, so with the burn unit, a couple of different things to remember is that we have an inpatient admission, episode 1. Patient was admitted with burns, right hand, fingers up to the wrist. She reached into hot water, not realizing the temperature, while canning on their farm. Taken to surgery, they did an excisional debridement of the burns. It was carried out to prepare for the wound for the graft. They did a split thickness skin graft, was applied over the dorsum, and postoperative recovery was without infection. So remember, we have second and third degree burns of the right hand and fingers. 3% total body surface was burned. 2% affected by third degree burns. So let's go ahead, we'll get to episode 2. But let's go with here. So we are going to code burn of the third degree, multiple sites of the right wrist and hand, initial encounter. Then I get into my external cause codes. Okay. With this, let's go ahead and pull up the encoder. Too many tabs open here. Okay. So we are going to go to burn. And we have multiple sites of the right wrist and hand. Okay, so we have hand, multiple sites with wrist. We want to go down to what hand it was, which is right. Okay, and we know that we have third degree. So I'm going to go right down to third degree, T23391. Make sure I click on that. That's going to give us initial encounter. So that's going to be my first code. All right, so then it's going to be all our external cause codes, and then it's going to be the replacement of the right hand skin. Now, one thing to remember here with episode 2, they came back in. See how our 7th character has switched? So, on that note, it's going to be subsequent encounter. So that's why we switch it to a D. So, a couple other things with the burn. If I would have 2 or 3, let's just say it's all on the forearm of the right, and I have first degree burn there and a third degree burn. It's in the same area. I don't code them both. I only code the most severe since it is in the same area. So keep that in mind. And the other thing is the total percentage of body surface involved in optic burn. So keep that in mind, including the third degree. The third degree is only third degree burns. So our fourth digit is total body, and then our fifth digit is going to be just third degree burn. Keep in mind with that. So if anybody has any questions over this unit, it can be a little tricky. When I grade this, I really look at it and remember this is the first time coding a complex type of problem. So best of luck, and I look forward to correcting these.